So for the first module, I'd like to go over a little bit of the scope and risk of obstetric hemorrhage and look at the impact specifically on maternal mortality. The World Health Organization recently put out a document on the trends in maternal mortality, looking at mortality globally from 1990 to 2015. What they found was we are making some progress as we go from 1990 to 2015. The global maternal death rate has decreased around 44%, from 385 to 216 maternal deaths per 100,000 live births. If we put this in terms of corresponding risks for your lifetime, it's decreased from about a 1 in 73 risk globally to 1 in 180. We do see the largest decrease from this document being in sub-Saharan Africa, where mortality has gone from 1 in 16 down to 1 in 36. So even though we've made great progress in many of these areas, we still have a long, long way to go. So now let's talk about the impact of hemorrhage on maternal mortality specifically. These numbers come from a publication in Lancet in 2014, and I've broken them down specifically into different causes of maternal mortality, from hemorrhage to hypertensive disorders such as preeclampsia, infection, sepsis, miscarriage or abortions, and embolisms. And we can see that there's a pretty big discrepancy between the developed countries and the underdeveloped countries, where hemorrhage is about 16% of the cause of maternal death in the developed countries. And you notice if you go down the rows that these don't add up to 100%. And if we talk about developed countries specifically, what has surpassed these items that are on the grid is actually underlying cardiovascular disease, which is now the #1 contributor to maternal death in the United States. So if we move from the developed countries to now look at Africa, Asia, Latin America, we see that hemorrhage not only remains #1, but it's far more significant in these parts of the world. Going back to the developed countries, we see a marked discrepancy in the United States compared to other developed countries such as Germany, Japan, and Great Britain. When we go from 1990 forward in time to 2013, we see that the maternal mortality rate actually increased in the United States per 100,000 live births. So this is normalized by the number of live births. This is not due to an increase in population, whereas in the other developed countries, it decreased. And this is pretty significant because if we go farther back in time, if we go back to, say, the 1930s, even in developed countries, it was around 1 in 100 women who died from complications of pregnancy. And then we have orders of magnitude as we jump to about 1990, where it was about 8 in 100,000. So looking at this graph, it's sort of very telling that the mortality increased, and it made people wonder what that could be from. And the state where I was working in at the time, California, really wanted to dive down on this and see what they could do to improve maternal mortality in the state of California. So what they did was they looked at health records from about 2002 to 2004 and looked at all the cases of pregnancy-related deaths, from the major causes to the components of the patient's care that led to these increase to the specific cause of maternal mortality. And you can see them broken down there by cause, from cardiovascular disease, preeclampsia, hemorrhage, thromboembolic phenomenon, and amniotic fluid embolism. And with each cause of death, you can see some of the contributors, where the biggest one pretty much in every single case was delayed response to the clinical warning signs. You can see ineffective care. People weren't caring for the patient in an evidence-based, appropriate manner. Misdiagnosis, lack of communication, lack of consulting specialists, lack of continuity of care. And this was a component in every type of maternal death. Sort of even more telling was when this was reviewed by an expert panel, all of these cases were looked at, they broke it down into, had appropriate knowledge, appropriate care, appropriate communication been in place, what were the chances that that mother would have survived? And in blue, we have the good or strong chance. Now, if we average all of these causes of death together, there's around a 40% chance overall of altering the outcome of these mothers. But when we look specifically at obstetric hemorrhage, shown with the black arrow in the middle there, you can see that in 70% of the cases reviewed, there was a good to strong chance that had protocols and training and effective care been in place, these mothers might not have died. I have this slide, which is regarding mortality in the United States in red and mortality in California in blue. And what you see is that right up to around 2010, the rates sort of mirror each other. They're bouncing around and a little interwoven, but we see this increase in maternal mortality per 100,000 live births that I was talking about on earlier slides. And it was right around this time, 2009, 2010, that the California Task Force met and put together toolkits to more effectively manage maternal hemorrhage. I had the privilege of being part of the implementation of these toolkits at numerous hospitals statewide. And you can see that after the toolkits and collaboratives were implemented around 2010, you begin to see California decreasing its maternal mortality rate, where the rest of the United States keeps going up. Now, we don't know cause and effect. This could just be an association, but there weren't any other really big efforts going on in California that we were aware of at the time. And so we'd like to believe that there is some implication that this statewide effort to improve hemorrhage care across many hospitals did have an impact. So much so that toolkits with guidelines and protocols for preeclampsia were developed in 2013, and a cardiovascular toolkit was developed in 2015. So I take a lot of hope from our effort that this can be expanded globally, and we can make an even greater impact on reducing maternal mortality from hemorrhage. Thanks.